New Brunswick's healthcare system is facing a daunting challenge, ensuring primary care access for all. Health Minister John Dornan has a bold vision, aiming to eliminate the waitlist for permanent primary care providers by the end of his mandate. But with a backlog of 125,000 people, is this goal achievable? A promise to collaborate. The Liberals' campaign promise to establish 30 collaborative care clinics was a cornerstone of their election strategy. In November 2024, they vowed to have 10 clinics operational by the end of 2025, and the 11th was recently announced in St. John. These clinics are seen as a solution to the province's healthcare woes, but the road ahead is complex. The 14,000 versus 125,000 conundrum. On Monday, Minister Dornan unveiled the 10th collaborative care clinic in Bathurst, emphasizing the goal of matching 14,000 people with permanent primary care providers. However, he acknowledged the larger issue, as there are an estimated 125,000 people without a family doctor or nurse practitioner. Dornan's ambitious target is to eliminate this backlog, but the current plan only addresses a fraction of it. The government's official goal is to increase the percentage of attached patients from 79% in 2024 to 85% by 2028. Minister Dornan, however, has set his sights higher, aiming to surpass this target. He believes that as more doctors embrace the new service agreement and collaborative care model, progress will accelerate. Opposition skepticism and the real challenge. Glenn Savoy, the interim Progressive Conservative leader, shares the desire for 100% access to healthcare, but doubts the feasibility of the government's plan. With a growing number of retiring doctors, Savoy argues that the government's pace is insufficient to address the backlog. If the next 20 clinics follow the same pattern, only about 42,000 people would be attached by 2028, leaving many without primary care. The government's strategy of expanding existing clinics, rather than establishing new ones, is also under scrutiny. Green Party leader David Kuhn suggests that the government is opting for low-hanging fruit by investing in existing collaborations. He argues that creating new clinics is essential, and the upcoming budget should reflect the true cost of this endeavor. The road ahead, a collaborative effort. Minister Dornan's determination is commendable, but the challenge is multifaceted. The government must balance expanding existing clinics with establishing new ones to make a significant impact. As the province works towards its healthcare goals, the question remains: can New Brunswick achieve full primary care access by the end of the mandate, or is this a promise easier made than kept? What do you think? Is the government's approach realistic, or does it need a radical overhaul? Share your thoughts in the comments, and let's spark a conversation about the future of healthcare in New Brunswick.